A lot of paramedics are describing it as the worst they've ever seen. They're just exhausted. They're fatigued. Their mental wellness is affected.
How did this happen? That's the question at the top of many people's minds after news spreads that dozens of people have died from BC's heat wave, and many of them were seniors.
It's taken its toll on them, especially when they can't get there in a timely fashion, and they know that maybe that time frame might have made a difference.
Troy Clifford with Ambulance Paramedics of BC says they couldn't keep up with the demand. Over the weekend, he says call volumes were up 25 to 50%, adding they're in desperate need of support.
More ambulances added in the Lower Mainland to help us to meet the demands. You know, we know every year we're going up 6% on average across the province.
We need to transform our ambulance system into what the demands of the 21st century, because it was very much in structure prior to that, based on a model that no longer was relevant. And I think we've been doing that. But every ambulance system is going to be tested by this kind of record day.
Mike Klassen with the BC Care Providers Association says not all long-term care homes have air conditioning, but staff did their best to keep seniors cool. He says his greatest concern is for those not living in care.
If somebody was isolated and living alone, getting care at home, those are the people that I'm most fearful for.
Klassen warns it's up to all of us to reach out to the seniors in our lives when these kinds of temperatures hit. As far as what could or should have been done to prevent these kinds of deaths, BC Seniors Advocate Isabel McKenzie says there's no one easy answer.
It's very, very difficult to, at this point, understand exactly what could we have done. Where the Lower Mainland is not an area where air conditioning is the norm. Whether we move towards that, if we start to see more of these heat waves, or just other ways of cooling down, or backup plans that get out of that apartment. It's just going to be too hot to cool down.
Meanwhile, Clifford says the mental health of BC paramedics continues to suffer, as many question if they had more resources and arrived quicker, whether it could have saved lives.
I mean, that's an absolutely overwhelming thing on dispatchers and paramedics when they question whether more could have been done.
In Surrey, Ashley Burr, City News.